Good morning students. Today we will learn the next portion of the chapter components of food. First of all, we will learn what is diet. Students, the food that we eat during the whole day, that is called diet. But if we eat anything during the whole day, then we will not remain fit and healthy. So we should have proper food in our diet. That's why we need to have balanced diet every day. Now what is balanced diet? The diet that contains adequate amount of all essential nutrients, roughage and water for proper growth and development of the body is called a balanced diet. You know students, what are all essential nutrients? That are protein, fat, carbohydrate, vitamins and minerals. All these essential nutrients should be included in our diet as well as roughage and water. So if all these things are present in a diet, that diet is known as balanced diet. And if we have balanced diet every day, we will remain absolutely fit and healthy. Now, the composition of a balanced diet depends on sex and age of the person, occupation, that means what type of work they do every day, and special needs. Now, already I told you, balanced diet depends on sex and age of the person, students. That means a growing child needs more proteins than adult, because for a child it is their growing stage. At that stage, their body tissues, body muscles and bones are developing. That's why they need more and more proteins. Now diet also depends on occupation. That means like athletes, laborers, rickshaw pullers, they do hard physical work. So that they get energy, they need more and more carbohydrates. Now the balanced diet also depends on special needs. Like during pregnancy, a pregnant woman needs more protein in their diet for building the body of the developing baby, which is present in their womb. Now students, you can see here one chart is given, the recommended daily balanced diet for a 12-year-old child. You can find this chart in your book, page number 22. Let's go to next slide. Students, eating the right kind of food is not enough. Okay, so we should cook the food properly. Otherwise, loss of nutrients will happen during cooking. So, what should we remember during cooking? If cooking is done in excess of water and that water is thrown away after cooking, many water-soluble vitamins and minerals will be lost. So we should not throw that water, we should use that water while cooking. Next thing you need to remember, if cooking is done at very high temperature, many proteins and vitamins are destroyed. So we should avoid this. Now the next point, mostly thick peels are removed from vegetables and fruits. This also results in the loss of nutrients. Even students, sometimes we do washing off some peeled and cut vegetables. After cutting vegetables, we wash those vegetables. Then we cook it. Then also loss of water-soluble vitamins happens. So we should not do so. Now students, I will discuss about various deficiency diseases. What is this? Diseases that are caused due to lack of carbohydrates, fats, proteins, vitamins or minerals in our diet are called deficiency diseases. That means if we do not have balanced diet properly every day, what will happen? This type of diseases will happen. So we should have proper balanced diet. Now I will discuss about various types of deficiency diseases. First of all, I will discuss the types of deficiency diseases. The first one, protein deficiency disease. Second one, protein, carbohydrate and fat deficiency diseases. The third type, vitamin deficiency diseases, and the fourth type, mineral deficiency diseases. First of all, I will explain about protein deficiency diseases. The deficiency of proteins in diet leads to a disease called kwashiorkor. Okay students, so this kwashiorkor disease happens due to deficiency of proteins. Remember that. Now what are the symptoms of kwashiorkor disease? First point you can see is stunted growth. That means according to age, if any child fails to meet the proper weight and height, that means according to their age, if their height and weight is not proper, that means stunted growth. The second point, the skin becomes dry and scaly. Skin becomes rough and scaly type. The third point, the hair becomes reddish and begin to fall. And the fourth one, you can see the body swells up due to retention of water. Actually, due to retention of fluid in different parts of body, sometimes retention of fluid happens. That is known as edema. Okay students, this happens due to lack of proteins if the child is suffering from kwashiorkor disease. Now the fifth symptoms, limbs, especially legs, become very thin and the body. And you can see in the picture even large pot-like belly. They have large pot-like belly. That means it is the symptom of kwashiorkor disease. And bulging eyes, as if the eyes are coming out from the socket. Now students, I will discuss about protein, carbohydrates and fat deficiency diseases. You can see the deficiency of protein, carbohydrates and fats in the diet of children leads to a disease called marasmus. Okay students, so remember the name of the disease. Now what are the symptoms of this marasmus disease? Body becomes very lean and thin and so weak that the child cannot walk, they cannot move. And the second point, skin becomes very dry, thin and wrinkled. Wrinkle means lines are observed on the skin. Now the third point, ribs become prominent. You can see in the picture students, the ribs of the child can easily be seen. The fourth point is sunken eyes. That means whenever students, if you feel tired for a day long, you have done a lot of hard work, you haven't slept. So what happens that as if your eyes are very tired. That means it is known as sunken eyes, as if it is going in the socket. Now the fifth point, unable to digest and absorb food and may suffer from diarrhea. The child cannot digest their food, what they are having. Okay students, let's go to next slide. Now I will discuss about vitamin deficiency diseases. There are lots of vitamins, you know students, that I have discussed in which food, what type of vitamin is present, that also discussed earlier. Now I will discuss that if we do not have proper vitamins for a particular vitamin deficiency, there is a certain disease and their symptoms are discussed here. In the first point you can see vitamin A, and deficiency disease is night blindness. Here you can see what are the symptoms: poor vision and loss of vision in darkness or at night. That means that person cannot see, or a very poor vision if the person is in darkness or at night. Now the next one is vitamin B1. Deficiency disease is known as beriberi. What are the symptoms? Extreme weakness, swelling of legs, loss of appetite and weight. You can see students, extreme weakness you can understand, legs become swollen, and loss of appetite, that when they cannot have food properly, that's why even loss of weight happens. Now vitamin B2, skin disorders. What happens? Symptoms are irritation in eyes, dry skin, inflammation on the tongue, sore throat, even mouth ulcer, that means sore in the inner lining of the mouth. Sore means wounds. You can see bloods are coming out from these wounds in the mouth. This is the symptom of skin disorders due to deficiency of vitamin B2. Now the next one, deficiency disease, what that is? Pernicious anemia due to deficiency of vitamin B12. Symptoms are pale skin, deficiency of red blood cells, lack of stamina and appetite, and frequent headaches. Now another deficiency disease known as scurvy, which is caused due to deficiency of vitamin C. Here you can see in the picture, students, bleeding gums, one of the most common symptom of scurvy. Spongy and bleeding gums, wobbly teeth, loosening of teeth, that means wounds take longer time to heal. If anybody is suffering from vitamin C deficiency disease, wounds will take more longer time to heal. Next, go to deficiency diseases caused due to lack of vitamin D, that is known as rickets. What happens, students? Softened and bent bones. Soft bones are more susceptible to fracture. If the child falls suddenly, the bone will break. Bowed legs, you can see here the bent type legs due to malformation of leg bones. You can see here, I think. Now diseases caused due to deficiency of vitamin K, that is hemorrhage. Hemorrhage happens even newborn child, students. That means symptoms are excessive bleeding from wounds. If there is any wound, excessive bleeding occurs. It takes longer time to clot the blood. Even blood can come out through urine. These are the symptoms of deficiency diseases called hemorrhage, which causes due to the deficiency of vitamin K. Okay, students, up to this you will learn from your book properly. Thank you.